Going forward, after you've had your dental implant, it does take a bit of looking after. It performs and behaves like a tooth and will be susceptible to things like gum disease, like your own teeth will be. So we're here, all the team are here to help maintain this implant and keep it healthy and make sure that it lasts as long as we want it to. Sometimes implants can get a bit of gum disease around them, and we are all here, regular maintenance. You're going to look after it at home, we're going to look after it here for you, and doing that together means that your implant can last long term. So after your implant is placed, we will go through a series of instructions to help you look after your mouth at home, and really a list of do's and don'ts and things to avoid and things to do in the next few days after your implant has been placed. We will give you all the stuff that you need to look after the surgical site over the next couple of weeks. So it usually involves taking some ibuprofen, which will help with the swelling and any pain that you might experience after your implant is placed. We usually recommend a week's course of antibiotics, and that is usually metronidazole. This is an antibiotic that you can't have any alcohol with, so it's best avoided in the 7 days after your surgery. We also need to make sure that you're not smoking and not drinking alcohol in those 7 days. We'll give you a pack with everything in it. That will also include a mouth rinse to use for probably the next 10 to 14 days, and this keeps the surgical site extra clean. It means that it reduces the risk of infection, and it means that everything is clean. You're not going to want to brush that site for the next couple of weeks, so using this mouth rinse will really help keep the site healthy. So your final implant will act and feel like your own tooth, and that means that we really have to look after it in the way that we would our own teeth. We will show you how to floss around the implant, how to clean around it, perhaps using little interdental brushes or using floss, and that way that we are keeping your implant healthy. We'll also ask you to come in for 3 or 6 monthly hygiene appointments, which means that we're helping you do that and making sure that everything that you're doing at home is the right thing. Your implants will behave like a tooth, so therefore it is prone to things like gum disease, food trapping around it, and we need to ensure that what we're doing here and what you're doing at home are the right things.